One cosmetic procedure that used to be just a dream is now one of the most popular among men and also women. We're talking about hair transplant, a cosmetic surgery to move hair to an area that's thin or bald. Hair transplantation aims to restore hair growth in areas of the scalp with limited or no growth at all. Hair loss and thinning hair are a normal part of aging, but can also occur due to illness or trauma to the scalp. Some people who experience hair loss can choose to do a hair transplant for cosmetic or reconstructive reasons. For successful hair transplants, grafts must survive and adapt to new areas where they are transplanted. Clinical studies show that 85 to 95% of all implanted grafts easily grow in the transplanted area. This high percentage indicates that hair transplants are generally very successful. A hair transplant is usually carried out under local anesthetic and sedation, which means you'll be awake but will not feel any pain. There are two types of hair transplant: follicular unit transplantation, FUT, or strip method, where a thin strip of skin with hair is removed from the back of your head and divided into pieces, each containing 1 to 4 hair, and those who are placed into tiny cuts made in the scalp. The site where the hairs are taken is closed with stitches, meaning that you'll have a scar on the back of your head, but it should not be visible unless you have very short hair. The head does not need to be shaved, only the area where the skin is removed or trimmed. The other method is follicular unit extraction, FUE. The back of the head is shaved, individual hairs are removed one by one, and those are placed into tiny cuts made in the scalp. You'll have lots of tiny scars, but they will not be very noticeable. If a large area is being treated, you may need to have 2 or more sessions a few months apart. The recovery for this procedure is not as difficult or long as others. Most people are able to return to work about 3 days after having a hair transplant. However, you need to be very careful with your transplanted hair for the first 2 weeks after your surgery. The grafts will not be secure. After a few weeks, the transplanted hair will often fall out and later start to grow back. After 6 months, the new hair will usually start to appear. It is until the 12th or 18th month where the full results should be seen. It is important to know that you cannot have hair transplanted from another person. You have to be your own donor.